Okay, good afternoon, everyone. I'm Lieutenant General Randy George, Commander of 1st Corps in JBLM, and it's great to join you all again this afternoon. This is our 6th Facebook Live, and I'm joined by the Corps JBLM Command Sergeant Major Shane Pospisil. Thanks for being with us today. We're going to provide you the latest updates, as we've done in the past, against our fight against COVID, and share all the information that we have to ensure everyone knows what we're doing inside and outside of JBLM and why. We also want to discuss JBLM resources that are available to all of you, as well as some of our future Facebook Live events. Off camera again, but available to answer your questions, is our Garrison Commander, Colonel Sky Duncan, the 62nd Air Wing Commander, Colonel Aaron Stainpine, our Hospital Commander, Colonel Tom Bunt, and other experts. I'd like to start today by providing you an update on our ongoing efforts at JBLM and within our local communities. First, I want everyone to know that I've extended our current HPCon measures and minimum mission essential work status through at least the 13th of April. I expect we may have to extend this date to the right again, and I will follow up with you all again next week as we continue to analyze our situation here at JBLM. And obviously we still need everyone's help by following the COVID mitigation guidelines we've established in line with the state of Washington. As COVID-19 continues to affect our country and the state of Washington, some of our JBLM units are supporting local authorities and fellow citizens here in the state of Washington. In the last few days alone, your JBLM teammates have begun to support the Federal Emergency Management Agency, FEMA, as they base supplies on the installation. We're also setting up a field hospital in Seattle at CenturyLink Field and providing support to other units arriving to Washington to further that support here in the local community. Our field hospitals will provide care to patients who do not, I repeat, do not have COVID-19, so that the civilian hospitals can free up space for infected patients. These are critically important missions that our national leadership has directed us to execute, and we will help our fellow Washingtonians while also maintaining the necessary medical capacity here at Madigan. With everything that's going on, we must not forget about those service members affected by the stop-move order who now find themselves in what I call PCS limbo. Again, if you're one of these families, take a look at the JBLM Directorate of Personnel and Family Readiness and our MWR Facebook pages for a complete listing of available family resources. And you do not need a Facebook account to access those pages. As I mentioned before, the chain of command should be contacting all of you and already contacted all of you, but if you do not feel like you're getting the assistance you need, call my hotline at 253-967-3831. Again, 253-967-3831. Beginning this week, we are also hosting targeted Facebook town halls to specifically address the most talked about issues affecting our service members and their families. So what I just mentioned, the families in PCS limbo, assistance available to our pregnant mothers, and support to our exceptional family member program. So we can talk about that here in a few minutes, but that has been posted. It's up on our website right now with the schedule for this whole week. I know there's some other things, activities to do, how to volunteer, a little bit of everything, and I'll ask Colonel Duncan to talk about that within the next hour. Okay, I also want to mention that our website also includes a listing of available virtual religious services, and our medical and garrison teams continue to figure out ways that we can communicate with all of you, with our service members and families, as well as certain members of our community. But again, if there's specific areas that you guys need, please come up on the net. Share your ideas with us online. We can crowdsource, and we are always looking for ways to better deliver information and services. Before we open it up for questions, I want to reiterate again to please go to our JBLM website and Facebook pages for current and accurate information. Almost every day we publish the blue hash, and again, I think it's right up here. This information page highlights everything in yellow and any new COVID-related policies or installation information that's relative to all of you. And again, moving forward, we will continually communicate through multiple means to help you keep informed. Okay, with that, we'll start opening it up for questions. Okay, I'll ask our Madigan commander to come forward. The first one's from Katie. Will the hospital accept donated masks? If so, is there a specific type that is preferred?
Thank you, sir, and thank you, Katie, for the question. We don't really have a preference on the type. We just really highly encourage the donation. And I'm going to give you a number of 968-1901 to my PAO. And that goes for anyone who's trying to donate masks or other personal protective equipment they might want to contribute. And we'll connect you up with my PAO who will work it through the proffer process and make sure my attorney gets a chance to see it because he's right over here watching me. And we'll make sure we get that taken care of.
Okay, so I know a follow-on question will be how do we look with personal protective equipment? Do you have what you need right now?
Yes, sir. I have approximately 9 to 11 days based on the current burn rate. Our supplies have been coming in very well, surprisingly, with all the disruptions to the distribution system across the entire nation. But our stuff is coming in, and our folks have got the proper PPE to do their job.
Thanks, Tom.
Yes, sir.
Okay, next question is, why is JBLM no longer announcing or posting the number of COVID-19 positives? So as of last Friday, we were directed by the Secretary of Defense, by Secretary Esper, that we would no longer release the numbers. I will tell you that we've had a slight increase from the last time that we've been talking about it, so we are still, seeing an increase in numbers, and I'll just leave it at that. And that's obviously for operational security reasons, but there's nothing. We are tracking all that, and if anything affects you personally or those individuals around there through retracing or anything else that you've come in contact with, we are continuing to do everything. So nothing else has changed as it relates to that. Okay, next question is from Samantha. Samantha asks, her question is, a friend has all the symptoms but is being denied testing. Okay. How can someone get tested if showing symptoms, especially those at a higher risk? Her husband is active duty. Dr. Leonard?
Yes, sir. Thank you, sir. So thank you, Samantha, for the question. Right now, we're still only testing those folks who are considered to be at a higher risk for poor outcomes as a result of having the disease. The CDC recommends, and as do we here at Madigan, that the best course of action for somebody who is experiencing mild to moderate symptoms with no other risk factors to stay at home, because the actual risk of that person coming out and then spreading the disease to others is much greater than the benefit they would get from either the result of the test or any kind of therapeutic modalities that we have, because we really don't have any therapy for this disease for those with the mild to moderate symptoms. If you have a high risk, if you're things such as lung disease or cardiac disease or diabetes or things like those high risk or above the age of 60, we are testing those people routinely. So if you fall into that category or you're severely ill, those are folks we typically do test.
Okay, and you can correct me if I'm wrong, Dr. Leonard, but if somebody really has a concern that they feel like rather than on Facebook or anything, they're getting a concern, I would say, hey, call the hotline, call the nurses hotline. There's things that we can do. We can address that. We're not saying that mistakes couldn't be made, but we definitely have several avenues to make sure that we can address those with you all.
Sorry, and I have to add one thing to that. So the one thing that we're really looking for is shortness of breath. So if you're experiencing difficulty breathing at that time, that's some time where you should seek medical care. It's not a question of whether or not you need the test, it's that you need medical care. So we have our emergency room is wide open right now for folks who are experiencing things like that.
Okay, thanks, Dr. Leonard. Okay, next question is, what has Madigan done to reduce pharmacy wait times? I'm going to ask Colonel Butt to come forward, but I just was over there today just to see what was happening over at the drive-in pharmacy, and I think the line was next to it was one or two vehicles, so I'm sure a lot of this has to do with timing, everybody wanting to show up when it's convenient for them. So
they didn't know you were coming. They didn't know you were coming, and they still managed to do that. I think the big message from the pharmacy is a caveat to the message that we had just a few days ago when we had the last town hall, is that this is an evolving process, and we're taking a pharmacy that does roughly 5,000 different prescriptions in a single day and converting 13 windows into 2 drive-up windows. And those windows had extremely long wait times for the amount of vehicles that were in them, and we were still working through our system and really hadn't worked all the bugs out. And that was the transparency I shared before. I'll tell you though, a credit to the team, they kept getting after it, and they evolved the process and making a specific refill requirement, specific new prescription requirement, and also handing out information for folks to have their medications transferred to an off-post pharmacy, and then use e-scripts and all those things, which I highly, highly recommend, because even as COVID or whatever situation can arise, those are great avenues for you to get your prescriptions rather than wait such a long time in that. And now it's down roughly between whether you, certain times of the day, 30 minutes, or it could be up to 2 hours if you decide to come up in the middle of the day. So I'd say plan your day accordingly when you go, and you'll be more than pleased with the times currently.
Okay, and then just for everybody, one thing that Colonel Bunt talked about doing was actually posting on the website an idea of how long you would have to wait, so wait times. That obviously there'll be a little bit of lag in that, but I think you were looking at doing
Right, we'll post kind of like average times for this time of the day, and you can make your decision on when you want to come.
Okay, well, thanks, Tom.
You bet.
Okay, next question, don't have a name, but question is Joint Base Langley used to announce 31 March, that beginning 1 April, only mission critical people will be allowed base access. Will that happen to JBLM? But we have no plans for that right now to change any of our measures. Again, we are in line with what the Governor Inslee has done here as far as the stay at home, stay healthy. We are still keeping the base open for our retirees and for other people in the community to come in and use the commissary, which we think is mission essential for our daily lives, and the PX and some of those other things that are available. So right now I see no reason. I will, again, like I've done every time we've done one of these, ask for everybody to take personal responsibility in making sure that we are following all of what we have established as by the medical professionals as a proper COVID mitigation measures. And as long as we're continuing to do that as a community, I think that will help us. I know that will help us and allow us to keep the base open as well. Okay, next is question is, when the government lifts the stay at home, will everyone come back to work? Okay, that's a good question. And we are, when the governor, I guess, lifts, not the government, when the governor lifts the stay at home, will everyone come back to work? Well, we have been in line with the governor that's here because we're dealing with the same environment. But we do have the flexibility here because of our mission and as a federal entity to do what we need to do, actually to start the installation back up and also to maintain our readiness. And that's the balance that we're after right now, with making sure that protect the force is our #1 priority. Our plan would be to, just like we've implemented things right now, would be to slowly come back with certain things. I'll give you an example. It may be we would open the gyms up initially to ID card holders only and spread out the time. So we are thinking through those kinds of things. Stay tuned, because when we start to bring some of those services back, we will talk about it in these sessions. We'll make sure it comes out in through the chain of command, and then we'll also post it to the blue hashes that we put out so that everybody is fully informed on what we're doing. And again, right now, through the 13th of April, we are staying at the current procedures and stay at home. Okay, next question is, why are food courts still open?
Thank you for the question. The food courts are still open because, as the CG mentioned earlier, we need life-sustaining capabilities. So food, shelter, water, some of those capabilities are the reasons we're keeping the exchanges open, the reason we're keeping the commissaries open as mission essential, and the reason we're keeping these food establishments open. They have been primarily focused on takeout. We left a few seats so the handicapped personnel, people with kids with strollers, can sit down for a few minutes while they're waiting for their food. But primarily every institution on JBLM that is open for serving food is for takeout. And we do know that a lot of people still want to be able to take out food and still need it to be able to sustain their lives. That's the reason the food courts are still open.
Okay, thanks. And again, I say this every time, if there's a place, if you don't want to go to those locations, then please don't. We are inspecting these places to make sure that they follow, and again, the COVID mitigation measures that we've established, and personal responsibility for everybody there to make sure that you're doing that. And we have 10,000 single soldiers and airmen that live on base, and so we're just providing some options for all of them. Next question is from Senatu. Why can't soldiers leave base? Soldiers can leave base. So again, this is in line with, when you're a soldier, can you leave base and go out to somebody else's house? No, because that's not in line with what we put out in the general order. Can you go out and go for a hike somewhere? Absolutely, you can do that. So there are options that you can go out. Could you go out and pick up a pizza somewhere that was a takeout? Yes, you could do that. All right, so there's right now there's no restrictions. And I'm looking over, same for us, and I'm looking at Colonel Steenpine for airmen as well. But yes, you can come on and off post. And again, just be disciplined and follow the mitigation measures. Okay, another question from Kelly. Kaylee, people claim the chain of command is telling spouses they can't leave post. Is that true? Okay, I'll just refer to the question I just answered. That's not true. So again, we'll ask that we all are responsible to follow the COVID mitigation measures when we leave the base. Okay, I'll give this one to the Sergeant Major. When will PCS limbo families have an update? I know it's still the 11th of May, but...
Yeah, that's a great question, and I'll tell you, weekly we are refining that, and we're getting guidance from the department in the sense of when soldiers will be PCSing. Right now, mid-May, but what we can do is reach back out to that long list of about 300 service members who are in limbo, PCS limbo right now, and we can give you an update. And there are ETPs, exceptions to policies, on certain situations that may pertain to you. So I would, one, encourage you to engage your chain of command if you have a PCS question. And if you're not satisfied with that answer, again, I refer you to the CG's hotline, 253-967-3831, and the CG or myself will absolutely get back to you.
Thanks, Sergeant Major. Yeah, go ahead.
Command Sergeant Major has an amplification to that. We just published on the Facebook site, if you scroll down just a little bit lower from this live link, you'll see a link to some mini town halls that we're going to set up. The schedule for those starts next week, and the PCS limbo, we have one specifically dedicated to PCS limbo, and I believe it's Tuesday. Check on that schedule, and we'll have some experts on there that will be able to address your concerns about if you are one of those people that are kind of in limbo between bases right now, whether you came from JBLM or on your way to here, or were simply transiting through and have stopped at JBLM. Please tune into that.
Okay, and again, I wanted to get back to the kind of combining that question that Sergeant Major just had, and with how are we going to start things back up? So a lot of questions, a lot of things that stopped across DOD here over the last, month, with moves, schooling, all kinds of things that we're going to look that are going to have to start coming back online. So we have a lot of things that we have to, questions we're asking as well, because they deal with the whole larger enterprise. So again, this is not going to be like a light switch where everything is back to normal. It's going to take a little bit of time. We understand there's a lot of specific issues that we're going to need to work for folks, but there's a lot of just broad questions that I think we're going to have to answer for everyone. Should we begin to wear masks? Dr. Leonard? I think I can answer that one myself, but I'll let the pro.
So the answer is based on the context. So if you're a healthcare worker who's coming in contact with COVID-positive patients, then absolutely. There's been some guidance put out. I don't want to call it guidance. Some information put out that says that just about everybody should wear a mask, and I kind of discourage that, because what a mask does for most people is that it protects you and prevents you from touching your face, and that's what we're really trying to avoid. So if you can stop touching your face without a mask, I completely emphasize that. Also, washing your hands, just the regular public health measures that we've been saying over and over again are the most helpful things to do, social distancing especially.
Okay, and I'm going to just personally, this weekend I watched a video on Vimeo of Dr. David Price, who works at Weill Cornell, pulmonary doctor that's there working in ICU with COVID patient. It's on, again, Dr. David Price on Vimeo, and look it up, and he can answer a lot of that. It's a great hour-long video that he's done specifically with his family and some of his coworkers that I think is good. Our docs are putting all that stuff out. Again, I want to stress that we've got videos. They're producing those if you have a specific question that's out there. But that's a very informative video that I know I watched. My wife watched it, and I thought that was very helpful. Okay, what should dual military families do if they do not have child care? Okay, so I don't know the specifics on this one, but I'm going to give you a couple answers. First of all, I would expect that the chain of command is making accommodations if required. If both of the military members are mission essential, then I know we will make room for them in the Child Development Center. That's exactly what we're doing. We can make room for those in those instances. So again, if that's not happening, I would expect you to come forward, and because that's exactly why we're doing that. And then again, if one or the other maybe shouldn't be mission essential, I don't know the specific situation, but I know that we can take care of your specific need.
That is absolutely true, sir. Yes, please work with your chain of command. Get if you're not already, for some reason, we're missed on that mission essential list, we will bring you in and we will get your child, take care of your children in the Child Development Center or the school-age services. We're also assessing right now the possibility of opening up a few slots to intermittent or part-day care. So intermittent, maybe like Monday, Wednesday, Friday if you have shift work or something like that, mission essential, or part-day care if you're mission essential and you're a swing shift and you need care for the morning shift or something like that. We can work with those all as well. Please, again, work that through your chain of command.
And one thing I would add on the dual military couples is we've crossed this situation in the last few weeks, and we're doing exactly what the CG just talked about. Both chains of command that the service members belong to need to work this out. And that's a chain of command's responsibility. It's the same thing that's required per the regulation for a family care plan. Both chains of command come together, sit with the service members, and work that out. What we are not encouraging and what we are not asking you to do is have whoever your family care plan provider is to fly out of state to come be your child care provider so both service members can work. And so I would ask if those specifics come up, have your chain of command get with your husband or your wife's chain of command or your spouse, and let's work that out. And again, if they can't figure this out, we're more than happy to help do it for you.
Thanks, Sergeant Major. Next question is from Angela. Angela's question is, where can I find information regarding the retirement recall? I've had no luck getting in contact with anyone. Okay, so they wrote on the bottom of this one, this is one I actually got some assistance because I didn't have this number. So the number at Human Resource Command is 502-613-4911. 502-613-4911. Obviously, they're working for they're mainly looking for medical professionals. So nothing against infantrymen or pilots or engineers or anything else out there, but they're primarily looking for medical professionals right now. And then the other thing I would say is we could probably go to the volunteer button, or you find a way to reach out to us here at JBLM or at Madigan, we'll find a way to connect you to the right folks. We'd be happy to have you out here. Okay, the next question is from Carly, and it says, why is the time for high-risk people closer to the time of closing at the commissary? So I guess the question is, why is it at the end of the day? They obviously want it at the beginning of the day.
Thanks for the question, Carly. We had to designate certain hours for the retirees and the higher risk population. We chose to do it at the end of the day for several reasons. Many stores around our community, we are one community amongst 15 surrounding communities. Many of the stores around here are doing it at the beginning of the day, so we wanted to give an alternate option. We wanted to do it also at the end of the day to allow the commissary to stock shelves with the specific items that are required for those retirees, so they're preparing for those specific hours. I do understand that there are still folks coming in throughout the day, so we are not, while those are dedicated hours for retirees or at-risk population, we are not restricting people. So kind of going back to something the CG mentioned earlier, you can still use those additional hours if you feel like that, if you feel like the risk is not severe enough for you, but we do have the dedicated hours specifically for those people if you need them.
Okay, I'll jump in on that one a little bit, but Liana asked a question about the commissary. Can you limit high demand items at the commissary? I just was over at the commissary, and they did, I can report there was toilet paper there. I won't say that it's still there. So they are limiting how they move stuff out. I think our stockages levels were better. So I will thank everyone out there for only getting what you need, and until I think the situation from what I got over there is starting to come back to normal. Trucks are starting to show up. We're starting to see that throughout. So we have been limiting high demand items and over at the commissary, and that seems to be working. Okay, next question is, what should I do if I have an at-risk dependent and I am mission essential? Do you want to answer that one, Dr. Leonard? So I'm mission essential, but when I go home, I have an at-risk family member. Okay,
so I've seen some really great stuff online as well as in this Facebook, the comments in this Facebook about things that people are doing. And I'd encourage you to follow some of the same things that we follow as healthcare workers. You know, as healthcare workers, are that population that's the highest risk of being infected and bringing it back to their family. Setting aside a pair of shoes, you know, a place where you can go as you come home before you actually enter the home, where you can, what we call doff, take off your uniform or whatever it is you're wearing for the day, and then have a separate entrance you come into the house. It's if you have the opportunity to do so, a separate bathroom, place where you can wash your hands especially, and do some basic personal hygiene before you come in and you see the rest of the family. Other than that, those are just the same kind of guidelines that we give to the healthcare workers who are working with these patients who are expressing large amounts of virus. So if you're in a population that has actually a fairly low risk of somebody getting the disease, following those measures should be more than adequate.
All right, the next question is JBLM allowing soldiers to travel for schools? Almost all TRADOC schools have been postponed. In rare cases, travel is postponed with an ETP. So right now, Department of the Army is all TRADOC schools for soldiers to attend, whether it's PME or specialty schools, are on hold. There are some troop schools local, like I'll give you an example, Basic Leaders Course, BLC, which is still being conducted distant learning, and that starts on the 13th of April. Some others, again, are on hold, but no soldier right now from JBLM should be on TDY orders to travel to a TRADOC school.
So again, that's what we talked about earlier as far as starting all these things back up. It's going to take some time to figure out with school slots and how basically this is going to start up across the Army. I'm guaranteeing the Air Force has the same issues with just everything coming to a screeching halt. And so those are some of the things that we'll have to work through, and we're definitely mindful of that. I will remind you all, that it will be great. And the expectation is you're still doing your PT every day and you're doing whatever you can to improve yourself personally while you have this extra time. Okay, next question is from Jessica, and I'm going to give this one to our Madigan Commander, Colonel Tom Bunt. Can I get an appointment that is not COVID? I keep hearing go to urgent care.
Okay, all right, Jessica. Okay, thank you for the question. Yes, you can get an appointment that's not COVID. It's just not going to be a routine type of appointment typically, but that all depends. I would ask that you contact your provider or use the MHS Genesis portal to kind of initiate this conversation on whether or not you need to have that appointment face-to-face or whether you could do it virtually, which is what we would highly recommend because, one, it's very effective, and two, it's an improved system. If you're lucky enough to be in the Pacific Northwest or Northern California, you are the only population that is able to use the MHS Genesis portal, which is an awesome piece of equipment right there. You could send images, you could send video, text, you can have open discussions with your provider, all of it's PHI, PAI corrected, and it is a benefit for you based on the MHS Genesis Enterprise implementation that Madigan and 8 of the facilities have done. So I actually did exercise that, take a chat with your provider, and then follow up to figure out if you need to come in, which is safer if you don't, and you can get your appointment taken care of that way. Ashley asks, will those who have doctor's appointments postponed be worked back into the schedule? Thank you, Ashley, for the question. Currently, it depends on what type of appointment that is, because everyone who had an appointment has been getting contacted, asked to whether or not they want to reschedule a later date. If it's a surgery, those are put in the queue based on priority, and also because a lot of people might come up in the interim with a more immediate issue, but more than likely you'll put right in that same category line, if you will, in terms of where your place was in line. But it depends on the type of appointment you had and whether or not that could be addressed in a virtual appointment, a portal discussion, or a face-to-face requirement. That's why I keep emphasizing that, to have those discussions to find out what is the right medium for you. We're pushing a lot of virtual because we never did it like this before, and what we're finding is about 60 to 70% of these appointments could have probably been virtual the entire time. Saved you the time to come in. You could do refills. You could just your stats. You can look at even your blood work, everything through that same mechanism. It works.
Okay, next question is from Carrie. Why are staff duties upping their manning when this will increase more possible infection? I'm not aware of staff duties up in their manning. I think there is an expectation that we are still doing the things to maintain good order and discipline and taking care of our barracks and facilities and have a chain of command presence throughout JBLM. And I also don't think that if we're following the proper procedures, it's not going to increase infection. Do you want to?
So there has not been a directive from either the commander or myself to up staff duties. Again, that is a commander's decision at his or her level on how they want to run their CQ or staff duties. But what we have encouraged them to do is add additional personnel who are doing the leader checks during that tour of duty, i.e. some medics that can go through the barracks. And that is because as we have more soldiers that are in the barracks and not at work, or soldiers in the barracks that may not be feeling well, this is an opportunity not just for leaders, but for our medics to check on our soldiers to make sure that they're doing okay.
Okay, next question is from Donna. Colonel Duncan, I'm going to ask you to come up on this one. Is EFMP paperwork for PCS still being processed?
Thank you, Donna. As of right now, EFMP PCSs are on hold for via Department of the Army and, in fact, Department of Defense guidance. So there are no EFMP PCSs right now without an exception to policy. So if you get an exception to policy signed by a general officer in your chain of command, then that PCS might still happen, and we will definitely in-process you if you come to Joint Base Lewis McChord. If you are already on Joint Base Lewis McChord and have just arrived within the past week or so, we will absolutely in-process you and get you involved in the EFMP system. but all PCSs into or out of any installation worldwide for EFMP are on hold right now with no known date of when they will reinstitute that. So if you need an ETP, please work through your chain of command. As an aside, we also have one of these mini town halls that I mentioned earlier with that schedule that's published on Facebook. One of those is specifically about how to care for your EFMP folks, your EFMP families during this COVID time. We can touch on this topic a little bit if you want to also join in that town hall later on next week.
Okay, thanks, Guy. Nick, I don't think again, back to the date, 11 May is right now what we're tracking as far as moves. Obviously, it'll take, we've had probably 2 months, month and a half of nobody moving, backup of, and there's only so many moving trucks. This kind of gets to, again, the question of how is this all going to look when things get started back up. It's not going to be everything, life is normal immediately. So we're going to have to work through that and figure out dates and orders being republished and doing all those things. So I'm confident we'll be able to provide those services quickly, but I think schedules, as we know, are going to be disrupted a bit.
Yeah, this will be an interesting summer, sir, depending on, I know Department of the Army and Department of the Air Force will publish orders. They're not just going to push every single person and PCS everybody in June all of a sudden. They're going to push them out in a trickle, but we'll continue to work with all the transportation service providers through Joint Personnel Property Shipping Office to get people PCSed in an orderly fashion to and from our installations.
Thanks, Guy. Next question is from Aaron. How will this affect CTC rotations? I'm trying to think within First Corps for CTC rotations. We got a couple of months before we have a unit that's actually going to go, but the next several, I think, have already been canceled. At least the next 2 CTC rotations have been canceled. So, and I also think that once they get back going again, that CTC rotations will probably shift a little, and then they may look a little bit different as far as the conduct of those rotations. Next question is from Brandon. Brandon asks, what is the likelihood of visitors with valid passes being restricted from accessing JBLM? Okay, one thing I asked this yesterday of the garrison, I asked, what's the number of passes that we have out? And I asked for everybody to look at this across the whole installation. We do have people right now that are coming onto base and going in and doing things that we've asked not to do as far as gathering socially and doing those things. And so we are interested in clamping down on that. So again, I get back to the personal responsibility. I've not made any decision yet on any of this as far as changing the access, but it is something that we are taking a look at. So I would ask for everybody just to follow the rules that are beneficial for all of us in our community. Sergeant Major.
Yeah, so let me follow up on the PCS question real quick that the boss answered. One additional thing that soldiers can do is request through their chain of command, through the branch and Human Resource Center, to defer their PCS up to 1 year past their original PCS date. So if you haven't seen that message, I encourage you to speak to your commanders about that. And if you fall into that category, you can request that. The next question that I received says, will soldiers who are finishing schools on other posts or installation return or be allowed to return to JBLM? The answer is absolutely yes. In some cases, the soldier needs to request an ETP, exception of policy, that the commanders will sign. In other cases, as soon as they graduate that course, they're allowed to get on an airplane or get in their POV and return to JBLM.
And I know we're tracking those by the EACHs and have good situation awareness on all of those and can assist with any one of those. Okay, next question. I'll give this to the Sergeant Majors from Emma.
Okay, so it's a good question. It says, why are chain of commands telling soldiers haircuts are still mandatory? Well, I think at two Facebook Live town halls we did, I said that no one is going to get in trouble for not getting a haircut, that commanders aren't making soldiers get haircuts, and so if we have soldiers or leaders out there telling soldiers that it's mandatory, I would just refer you back to your commander or command sergeant major, because commanding general or myself are not telling people to get haircuts during the period that the barber shops are closed. But I also did say that I encourage you, if you have a set of clippers, to keep your hair in good order. And if you can't do that, then we will deal with your haircut when this COVID crisis is over.
I'm blessed to naturally not have a big hair problem, so that's the other advantage for some of us out there. Next question is from Ron. Will this be affecting retirement personnel? How about household goods? Okay, so the answer, I think we've answered this a couple of times with these. Retirements and ETSs are still going forward. So no change to retirements or when soldiers have finished their term of service. Aaron, do you have any comment on that for airmen? Exact same for airmen. And they can still ship household goods. We can still do everything for retirees and folks getting out.
And for retirees, there's also a message that came out that you have the option, if you're not at your MRD, to request to extend your retirement. But soldiers that are in or ETS status will still be allowed to exit the military.
Okay, next question's for Michael. I'm going to ask Colonel Bunt to come up again. Is there a mask type required for donations?
Okay, hey, thanks, Michael, for the question. There is not a mask type that's required. I mean, I would ask that if you have masks that you want to contribute, that you call that, I put that down as my 968-1901 number as my POC for collecting all those things, because we're really not trying to define what type of mask. We just would like to see the collection, because there's always a way for us to mitigate that once we have the mask. But right now, we'll just take any that you want to contribute.
Thanks, Tom. Okay, I'll ask Colonel Duncan to come up and ask Brittany's question. What is the CDC doing to protect children besides just checking children when they come in?
Thanks, Brittany. So I'm glad you're aware that we are checking children and family members when they do go into the CDCs. We're doing the questionnaire and a temperature check, either with a temple touch thermometer or with a thermometer for the adults as well, to check everybody when they come into the child development centers, because we understand and agree that the health care of our children is critical. So while they are in so then once you've passed the questionnaire and the screening and bring the child into the CDCs then go into what is essentially normal practice. The CDCs are built and regulated and structured and cleaned to prevent spread of illness on a daily basis. I mean, these child development centers are open year-round, and they have hundreds of children in them, so they are built to specifically prevent the spread of any disease, regular flu, cold, sniffles, small groups. They're cleaned every hour, every day, deep clean, and every hour the providers are wiping things down. That's sort of normal business. Now, amplify that with COVID business, and they are deep cleaned even more often. They're deep cleaned with specific sanitizing solutions that kill viruses. They're deep cleaned every piece of equipment, every doorknob, every toy, every book, every computer mouse. If they're in the computer labs, all of those things are deep cleaned regularly to ensure that no spread of disease specifically during this time. So the CDC workers, and we've mentioned this a couple times in the town halls here, these ladies and gentlemen are doing amazing work to take care of your children, and they deserve the greatest, highest kudos and the greatest praise, and because they are caring for the kids and they're cleaning up. They're doing, on top of that, they're doing just very rigorous cleaning to ensure that no more spread of the disease. Sure.
Okay, next question's from Joan. I know I'm going to have to get either Colonel Bunt or one of our good doctors up here. Is red eye a real symptom? I don't know. I know you if you're staying up too, maybe you're staying up too late, or you had one too many to drink last night.
That's a good start, sir. Yeah, exactly. So there's a protein list of symptoms that are associated with the disease. There's not really anything consistent except for three things that we continue to emphasize. Number one, fever. Number two, shortness of breath. Number three, persistent cough. And a lot of times people talk about myalgias or the muscle pain. Those are really the consistent symptoms. But one thing you have to keep in mind is that there are a lot of other viruses and other infectious agents. And as anybody's been outside knows, and especially someone like me who has seasonal allergies, this is the season for it. So a lot of us are struggling with seasonal allergies, with regular colds and flu, and COVID is actually just a very small part of that entire big picture. Oh, sure, sir. So this is a question from Charlene. Is Madigan giving scheduled immunosuppressant shots? So this falls in the same category as one we've talked about in a previous town hall, and that was about regularly scheduled immunizations for children. While well child exams for the most part are being put off, those that are associated with immunizations, or I could put this in the same category, immunosuppressant shots, are still being scheduled. So if your question about it, as Colonel Bunn said earlier, messaging your provider through the MHS Genesis portal, calling the Puget Sound appointment line, and I actually have that number right now. I was prepared for this kind of question to actually make an appointment, and that number is 1-800-408-4506, and you can actually make an appointment with us at Madigan for these kinds of appointments. Thank you.
Okay, can we, and some of these numbers, these questions have come up a couple times. I'm looking back at our folks. Can we make sure that we get that, post those in some place? I know they're on the Madigan Hospital, but on the JBLM websites, and just make sure that we got that. We can tag them, maybe most commonly used numbers, to our Facebook site, just to make sure we have that readily available. Okay, next question's from Michael. His question after my heart: how long until the gyms are reopened? Right now it won't happen before the 13th of April, because as I mentioned earlier, we're not going to change anything before that, but there's lots of other activities that are out there and available, and I know folks are using in very small numbers some of the beaver fits and different activities and different portable gyms that we have there, but the gym facilities will not be open for at least another 2 weeks.
All right, Evers, question says, what are the guidelines for soldiers returning from maternity leave? Currently, there is no change to the maternity leave policy. So postpartum and all that still falls in line with the guidance. But I will tell you, again, you need to talk to your chain of command because you need to determine if you're mission essential or if you have child care needs, and that chain of command can work with you. And again, you might have a question, a follow-on about the CDC. Your chain of command can work with you if you are considered mission essential, and then we will work with you to get child care at the CDC.
Okay, next question's from Dariella. Can you give us a better understanding why it takes the installation months to turn around a home? So it's a housing question. So, good question.
Okay, thanks, Dariella. Dariella, thank you for the question. We're actually surging right now on turning homes and making them ready for occupancy. A vacant home right now, turning them and making them ready for occupancy no later than the end of May. So we had about 600 homes out of our 5,159 homes that were not available for occupancy, have not been for a couple months now. We are turning all those, we meaning Garrison along with Lincoln Military Housing, our RCI partner on this, and they will have them complete by the end of May. We will, so if you are on the wait list, you'll be getting a call sometime between now and the end of May to possibly move on base, depending on where you are on that wait list. They're going to obviously start from the top, the normal wait list procedures, to invite you to move on base if you still want to move on base. If you don't, just simply tell them no, you're fine where you are, and they'll go to the next person online and offer those homes. There are 3 neighborhoods. This is a good chance to reiterate the fact that we have 3 neighborhoods we're going to do full renovations in on base. New Hillside, those renovations are already going on. These are complete, what we call a full renovation. Take it down to basically just the walls, new kitchens, new bathroom layouts, new floors, new wiring, plumbing, etc. Basically a whole new home. Looks similar from the outside, even new landscaping though, so it actually it looks new even from the outside. New Hillside, Davis Hill, and Heartwood. All 3 of those will be renovated starting this summer, and Heartwood, in fact, is already undergoing now.
So I can say this is something that Colonel Duncan and his team, since we've been going through this with COVID, we have had several virtual meetings to talk about housing and continuing to press on housing, repairs, everything like he's just saying. So that we have not lost our focus. Again, that's our job, just to make sure we stay focused on those kinds of things. And he and his team have certainly done that. Okay, next question's from Chambray. Will this affect people med boarding? Will the process be halted in any way? Answer is no. This does not impact med boards, and the process will continue. The next question's from Allison. Is the ID card shop open for people other than active duty soldiers? Answer is yes. Next question's from Anna. Why are the optical shops closed? Glasses are a medical need. Actually, I think that the optical shops are private shops that are in there that get to decide if they want to be open or closed or not, and we can't dictate that they're open.
That's absolutely true, sir. Those are contractors through Army and Air Force Exchange Service, and they're contractors, and they chose to close down their own doors due to the proximity to the patient that they would be working with.
Next question's from Melissa. Will we see closure of non-essential stores like GameStop? Which is non-essential for me, GameStop for me, maybe not for some others. US Patriot, GNC, etc. So I would tell you, I'll answer this one. Again, I think this is, if they're not essential to you, don't go in those stores. And we are making sure, however, that we have limited the number of metering the number of people that go in the facilities. So there, again, shouldn't be an issue with that. This question's from Ashley. My family should be PCSing in early September. Will this stay as is, or will we get pushed back? Okay. Again, these are tough to answer, and having moved 17 or 18 times, I mean, I know what goes into all the challenges of moving and the necessary planning to make it happen. The stop move right now goes through the 11th of May. So that's all we know. And could it be extended? It could. We don't know. It's too early to tell. When we find anything out, we'll let you know. I do expect there to be some lagging effects because of the number of people who didn't move. I just expect that will happen, and that there might be some delays. And that's, again, what we're going to have to figure out. And what you can count on is, and this is again why when we start things back up, we're not going to just completely jump back in. There's going to be a lot of information requirements for everybody to get their lives started and get this things back on. So we will plan plenty of these forums. Colonel Duncan mentioned that we're having a specific to PCS as a virtual forum. We're going to continue to do that. And just to make sure that we have all of our experts, so our G1 folks can be up there, everybody can be tied in to make sure that we are explaining what's coming out and then how we can help you solve those problems. Okay, next question is from Emma. Emma says, can you send info out to the chain of commands because they are not putting out the same info as you all? So I was on yesterday with all the commanders, and so our major was on there. We're doing that, and we do hold daily meetings, so we do push this out. Again, I don't have it up here anymore, but the blue hash that gets posted and tagged to Facebook every day that kind of goes through this is there. It's also posted on the website. And then we also have, if there's specific questions that are on there that you're not getting answers to, we do have folks that we have now from our public affairs and our various specialties answer those questions on a daily basis to make sure that we understand the issues and challenges and how we can deal with them.
So I got a question that asked, is the First Sergeant's Barracks program open for soldiers who got married during COVID? Is finance open to assist with financial changes? So to the first part of that question, I would encourage you to, one, inform your chain of command that you got married. And your first sergeant and commander will work with you and your partner on living conditions. If you're currently in the barracks, and so is your spouse, I would tell you that you can go to finance and make those changes. And when you start receiving BAH, you should have accommodations to either, one, coordinate with Lincoln Military Housing to live in quarters, or two, live off the installation. But that is a chain of command question that they can easily answer. And yes, finance is always available to assist you.
Okay, I'm going to let our medical team start moving up here. So 2 questions that I'm going to give to you and your team, Tom. First, from Brandy, can pregnant soldiers receive a referral to an off-post women's clinic to avoid potential exposure? That's one. And then the second is, what process is in place for cleaning and disinfecting a site of potential exposure? And I don't know if you know where you or your doctors answer that, preventive medicine.
So come on up, Dr. Leonard. I want you to talk a little bit about the pregnancy piece. So I'm actually going to do this in reverse order and talk to Robert first. Thank you for the question, by the way. Was the process in place for cleaning and disinfecting a potential exposure site? Right now, the vast majority of typical household cleaners have the required ingredient. If you look at them, they actually say effective against coronavirus, oftentimes right there on the ingredients label. Pretty much everything that they're selling right now at the commissary of PX that have that, you can disinfect a site with it. You can also have sandy wipes and things like that. And if you have those concerns on that exposure, and obviously, and all the laundry detergents and things like that for clothing and things like that. Hopefully that answers your question. I would always keep a thing of sandy wipes in your kitchen, and I would keep them in high traffic areas and use them to wipe down your banisters, doorknobs, and things like that, so keep everything clean in the house. And this one deals with Brandy. Service members receive a referral to off-post women's clinic to avoid potential exposure, but this could be a multifaceted question, so I'm going to have my good doctor.
I'll take that one. Do you want to talk about sure.
Yeah, let me finish up the cleaning one. Thanks, and then I'll give it over to you, Doc. We're going to take this one for a couple minutes. All right, so the team clean, we have 2 teams clean. They're 5-person teams that go out around base and clean up any area if we've had any sort of exposure to COVID, either from a positive patient or even in a quarantine area if needed. These are dedicated active duty soldiers and airmen that go out, and they go out with the advice of a preventive medicine doctor, and they go out in preventive equipment. They wear their PPE, and they go out and deep clean any area that has specifically been put at risk. And they do it with preventive medicine approved solutions, disinfecting solutions, and they are available 24/7.
So, Brandy, I wanted to address the question about can pregnant service members receive a referral to an off-post women's clinic to avoid potential exposure? And I want to dispel maybe a myth that exists that there is a COVID-free zone somewhere in this country, and there really isn't. There is some areas that are much heavier, New York, Louisiana, King County, and there's some areas that are a lot lighter than that, in the middle of Montana, for example. And that all has to do with the density of people there and how well they practice social distancing. So irrespective of where you get seen, the precautions are the same. And for some reason, I think that there's this myth that maybe there's a higher chance of being exposed here at either Madigan or JBLM, and that is certainly not the case. We're actually lower for the percentage of positive cases that we have compared to Pierce County in general. So we're actually safer probably than outside.
Thanks, Dr. Leonard. Next question's from Tristan. So if I wanted to fly a parent in to help with childcare, can my unit prevent me? So can they come on post? Right now, again, we haven't closed on post. If you're a soldier, I would tell you that I have, put out a general order that basically states, the guidelines, and that would be outside of that guidelines as far as doing that. So if you had specific questions, I think for all these individual ones, I would ask you to get in touch with your chain of command. I also know that we have the president and our leadership has asked everybody basically to stay in place across the country. So again, I think that that's what we're looking at. Most of when I've been briefed on, most of our cases have actually happened from people that have traveled. That's how this outside into a lot of those same areas that Dr. Leonard was talking about it. So if you can prevent, if you don't need somebody, absolutely need somebody to fly in here, then I would say I would wait. Okay, next question's from Dwayne. I don't know, Aaron, if you can answer this, or Sky, will the McCord Museum remain open?
Hey, Dwayne, thanks for the question. We are going to close the museum itself. That's run on volunteers, and certainly some of those volunteers are in a higher risk age group, and so we don't want to raise the risk for any of those volunteers. The air park, though, will certainly stay open and is a great option for you to still go walk around and get outside.
Okay, last question. This is from Aaron. Tom, I'm going to ask you to come up and answer this one. Is there a hearing clinic open for hearing exams? What? I can't hear you.
Sorry, sir, is there a hearing clinic open for all those who are listening out there? There is not at this time a hearing check open right now, mainly because of the close proximity you'd have to be in to actually conduct that kind of test. If there is an emergent kind of ENT, ear, nose, and throat type of issue going on there, that is a totally different thing. And those are great questions to put on the portal or to call on the phone and talk to your provider about, to kind of give them, hey, what is it that makes you think you need to have a hearing exam right now? If you're losing hearing in your ear or something to that effect, it could be a whole multitude of different things. So I would ask to kind of follow up that way, but no routine type of hearing appointments at this time.
Thanks, Tom.
Yes, sir.
Okay, I wanted to, one of the things that we have been talking about, because I think we have fewer listeners today, and again, our goal here for these town halls is just to make sure that we are telling you exactly what we know and what we're doing and why. That's very important to us. And if anything we've learned out of this is that we can do a lot more virtually than we have, and we will continue to improve on that. However, we are looking at going to town halls once a week next week. So I would like everybody's feedback on that. We certainly are welcome to continue. We now have this week. We'll continue with Friday, so we'll do 2 town halls this week. And we will do the targeted sessions. We're looking at going next week to Wednesday. That is something that we will talk about also and get out as information through the chain of command. We will post that out and ask for that specific question on Facebook and on our websites, but we're looking at going for once a week. And again, Sergeant Major and all the leadership up here, we appreciate everyone's flexibility. We appreciate your personal discipline and the responsibility that you're all demonstrating. And again, I know that all the units out there across JBLM are doing their best to help take care of everybody. But if there's a question or concern that you don't think is being addressed, again, you can call the hotline at 253-967-3831. Have a good evening.